My name is Dr. Rodriguez. I am a weight loss doctor in weightrx.org. Did you know that semaglutide is a glucagon-like peptide 1 receptor agonist, GLP-1RA, used in the management of type 2 diabetes and obesity? One of its significant advantages over sulfonylureas in the context of weight loss and diabetes management is its lower risk of hypoglycemia. To understand how semaglutide achieves this, we need to delve into its mechanism of action and compare it to that of sulfonylureas. Semaglutide stimulates insulin secretion only when blood glucose levels are elevated, such as after a meal. This glucose-dependent mechanism ensures that insulin is released in response to physiological needs, reducing the likelihood of excessive insulin secretion when glucose levels are normal or low. Suppression of glucagon secretion. Semaglutide suppresses glucagon secretion when blood glucose levels are high. Glucagon typically promotes glucose production by the liver, so its suppression further helps stabilize blood sugar levels. By slowing gastric emptying, semaglutide reduces the rate at which glucose is absorbed into the bloodstream after meals, contributing to more stable blood glucose levels. Central appetite regulation. Semaglutide acts on the brain to reduce appetite, leading to weight loss, which indirectly improves insulin sensitivity and glycemic control. Mechanism of action of sulfonylureas, such as glympyride or glyburide, work by stimulating insulin secretion from pancreatic beta cells. They achieve this by closing ATP-sensitive potassium channels on the beta cell membrane, leading to depolarization and insulin release. Unlike semaglutide, this mechanism is not glucose-dependent, meaning sulfonylureas can stimulate insulin secretion even when blood glucose levels are low. This lack of glucose dependency significantly increases the risk of hypoglycemia. Semaglutide's glucose-dependent action ensures that insulin secretion is modulated based on blood glucose levels, preventing unnecessary insulin release when glucose levels are normal or low. In contrast, sulfonylureas continuously stimulate insulin secretion, regardless of glucose levels, which can lead to hypoglycemia. Preservation of counter-regulatory mechanisms. Semaglutide does not impair the body's natural counter-regulatory responses to hypoglycemia, such as glucagon release during low glucose levels. Sulfonylureas, on the other hand, suppress these responses, further exacerbating the risk of hypoglycemia. Weight loss and insulin sensitivity. Semaglutide-induced weight loss improves insulin sensitivity, reducing the overall insulin requirement and stabilizing blood glucose levels. Sulfonylureas often lead to weight gain, which can worsen insulin resistance and create a higher demand for exogenous or endogenous insulin, increasing the risk of hypoglycemia. Steady and predictable action. Semaglutide provides a consistent and predictable glucose-lowering effect, especially when administered as a weekly injection. Sulfonylureas, on the other hand, have a shorter duration of action and can lead to rapid fluctuations in insulin levels, increasing hypoglycemia risk. Clinical evidence supporting lower hypoglycemia risk. Numerous clinical trials have demonstrated the lower risk of hypoglycemia associated with semaglutide compared to sulfonylureas. The SUSTAIN program, a series of global clinical trials evaluating semaglutide, consistently showed that semaglutide reduced HbA1c levels and body weight with a lower incidence of hypoglycemia compared to sulfonylureas. This is particularly significant in patients with type 2 diabetes. Real-world evidence. Studies involving real-world data corroborate the findings from clinical trials, highlighting semaglutide's safety profile in terms of hypoglycemia risk. American Diabetes Association, ADA, guidelines. The ADA recommends GLP-1 receptor agonists like semaglutide as a preferred treatment option for patients with type 2 diabetes who are at high risk of hypoglycemia, reflecting its superior safety profile over sulfonylureas. Conclusion: semaglutide's glucose-dependent mechanism, coupled with its ability to promote weight loss and improve insulin sensitivity, significantly lowers the risk of hypoglycemia compared to sulfonylureas. This advantage is particularly important for patients managing both diabetes and obesity, as it ensures effective blood glucose control without the added concern of potentially dangerous hypoglycemic episodes. Consequently, semaglutide represents a safer and more effective option for long-term diabetes management and weight loss.
For more information on this topic, please subscribe to our channel or text our clinic number. Brought to you by weightrx.org.